Hello, everyone. Welcome to Impact Talks, the show where we explore how organizations and individuals are creating a positive change in India and the world at large. I'm your host, Adesh. Ladies and gentlemen, we have the privilege of hosting a true luminary in the realm of corporate social responsibility, Dr. Kirti Chadha, the Chief Scientific and Innovation Officer and Group Head of Metropolis Healthcare Limited. Her journey and contributions in the field are nothing short of inspiring, and today we have a unique opportunity to delve into her experience, insights, and the transformative part of CSR. So before we start our conversation, I'll first take the opportunity to introduce Dr. Kirti Chadha to our audience. She is the Chief Scientific and Innovation Officer, Metropolis Healthcare Limited. She's the Group Head, CSR, Metropolis Foundation, the Senior Consultant Oncopathologist, ex-counselor, International Academy of Pathology, the Indian Division. She is part of the WHO expert panel for medical devices for cancer. She is also on the advisory board of Indian Cancer Society. She has over 22 years of experience in diagnostics. Prior to Metropolis, she was associated with multiple renowned hospitals such as Tata Memorial Hospital, PD Hindujas, Sir Gangaram Hospital, and other center of excellences. She has received numerous accolades and honors. To name a few, she is a gold medalist from Armed Force Medical College, Pune. She was awarded the Best Oncopathologist of the Year by the Associated Chambers of Commerce and Industry of India in 22-23. She has received the FICCI Special Award for Reflex conclusive diagnostic approach. She has pioneered and established digital pathology for Metropolis in India and Africa, introduced the concept of super specialty pathology at Metropolis. She has launched the prestigious CSR initiative, MedEngage, which extends scholarships, academic grants, and research support for young MBBS, MD, and MS students undergoing medical training. And then there's, of course, an exhaustive list. So, Dr. Chadha, we extend a warmest welcome to you for gracing us with your presence and Impact Talk today. We are sincerely grateful for your participation.
Thank you. Thank you so much. And thank you to you and your team for arranging such interesting discussions. Yeah.
Thank you so much, Dr. Chadha. So, to start with my first question, uh, I'm sure our audience is very curious to know about your journey of oncology and what inspired you to join Metropolis Healthcare Limited. And would you reflect on a defining moment or experience from your journey in the world of CSR that has deeply influenced your approach to CSR and maybe philanthropy?
Yeah. It's quite interesting, because I'm a hardcore doctor, right? So
Right.
I practice oncopathology and Metropolis gives a huge canvas. So you can reach out to more patients, you can impact more patients, you can interact with more clinicians, doctors, hospitals, and be able to influence more and more effective healthcare, whether it is cancer or it's anything else. So it's quite interesting that when I was studying, I was actually quite privileged, because I was in Armed Forces Medical College where everything is there, and it's up to you how good you use it and how good you turn out to be. But then I realized that everybody does not have the same infrastructure or the same facilities or the same uh, support when they are growing up. So when I call growing up, I mean the time that you are in MBBS and you are in MD and you need support. And I realized that there are not too many CSR programs for doctors, actually. So doctors, once they become successful, they can support everyone. But when they are still incubating, they need all the support because it's a very, very tough life being studying MBBS, internship, post-graduation, super specialization. So I did not know that I was doing CSR, but actually I was making many programs to help doctors along with our chairman, Dr. Sushil Shah. And we had a very structured program running called MedEngage, which was to nurture young medical students. And we won many awards. We impacted many lives positively. And because of that, then the top management suggested that, Kirti, since you are able to get the pulse of the problem, able to create a project or a campaign, collaborate with, the right people and optimize resources towards really helping the last person or the end user. Why don't you get into a CSR and, help the entire function? And that is also the time when Metropolis started Metropolis Foundation. So it was my privilege and honor and to be a part of CSR And it's been an exhilarating journey last 2 years that I've been doing CSR. And I sleep with a sense of calm and peace that we have helped so many more people. And apart from the doctors' fraternity, I have two young girls, adolescents, and
Right.
I feel adolescence is the most difficult age, whether you're a boy or a girl. And again, at that age, if you can educate them, empower them, encourage them, they turn out to be very fine human beings, and then they can impact society. And they can create families, they can create institutions, they can do a lot. But if they get lost during their adolescent phase, then it's very difficult to get these adults into the mainstream in a seamless manner. So that was the second area of Metropolis Foundation that we delve into, which is about adolescent reproductive and sexual health. And third area is again something very important, preventive healthcare. So when as a doctor I see a problem where now nothing can be done about it, right? Now, patient has to live with the problem. We cannot really treat it. We can just manage it. So I always feel that, oh God, this could have been prevented. Or, early detection could have saved the day. And that is where, the third policy of our CSR arm is about preventive healthcare. And so all these three things which we are running under our CSR umbrella over here are very interesting to me as a doctor. And I'm able to bridge this between CSR and medicine to be able to, help a larger population of people. So that's the journey.
Sure. Thank you so much. As you mentioned, of course, about the Metropolis Foundation, so which does a lot of good work for good cause in coordination with the government and the public health and the private. And you mentioned the some of the key initiatives. So, if there are any other initiatives, and also how additionally it would be valuable to understand how these initiatives are aligned with the broader objectives of Metropolis as a company.
Yeah. See, again, I don't believe in working in a silo, right? Because then what will happen that everybody will be putting parallel resources, parallel efforts, and we may not meet the unified goal. So, we live in a society, we live in a pin code, right?
Right.
So, we influence an area around us. Now, today, digitally, and of course, through the brick and mortar channel and wherever Metropolis exists. So, we realize that collaborating with the government on areas which the government has already identified are a problem area. For example, as you mentioned, collaborations, the first thing that comes to our mind is about the TB. Now, India is the capital for so many problems from, diabetes to tuberculosis. And, the government has launched a program called the TB Mukt Bharat Abhiyan. And anybody can become a TB Nikshare Mitra. And we decided that we must do that. So Metropolis has been helping the government, collaborating with the government. We have adopted more than 1,700 TB patients now. And they've had a 95% cure rate. And that is so satisfying because when you're helping a TB patient, actually helping the entire family, because most of the time this patient is the bread earner of the family. So in a way, we are again, Metropolis is all about healthcare. So somewhere again, we are improving the health of our main lab or the global reference laboratories in Kurla. All these patients that we've adopted are in the Kurla, region. And then we can obviously expand to Bandra, Andheri, rest of Maharashtra, then maybe to other states. So we also started delving into, apart from Maharashtra, we are doing some CSR work in Delhi North, some we are doing in Tamil Nadu, which is again a big area for Metropolis. So there has to be a team of people, there has to be support because CSR teams are very thin, So you cannot expect things to happen only by CSR. They have to be functional spokes. So you can use your infra, you can use your facilities, you can open your doors, and you can actually really combine the companies and the CSR mission and vision because the statement, the purpose of the company is always one, right? So it's basically to improve healthcare and to make a significant positive statistical difference in any indices that we pick up. So that's been the synchronization, and it has really helped us actually.
Right. And coming, as you mentioned about the adolescent girls, so they face numerous challenges related to sexual and reproductive health as well as mental health. So, as per WHO statistics, complications related to pregnancy and childbirth are the leading causes of deaths for girls aged 15 to 19 globally. Additionally, a significant number of young girls lack access to adequate sexual health services, and education, which can lead to increased rates of sexually transmitted diseases and unintended pregnancy. Also, mental health issues are also very prevalent. One in five adolescents experiencing a mental health disorder, according to UNICEF. So, and as well as we know that Metropolis Foundation works closely with adolescent girls and all these cultural critical issues. Can you elaborate on the specific programs and initiatives your foundation has implemented to support these young girls, and what impact have you observed so far?
Yes. So again, now when we come to these girls, right? Now, how do you reach them? The idea is, you can keep on planning anything in the boardroom, but has it reached the end user? So we decided that we have to do two things. We have to have a on-ground model, with NGO collaboration. We collaborate with excellent NGOs and we reach out to the girls on ground. But we also thought that we have to have a digital model. So we do both. So we have an app which we started in 2019 and it's called the Too Shy to Ask. Something that you're too shy to ask anybody. So
Yeah,
you can just raise an anonymous request, and within 24 hours, an expert will guide you. So we get a lot of queries and we're able to answer them. And these girls benefit, right? But how many people have phones and how many people have access to that also? See, we may feel that people have a lot of phones, but it may not be with that little girl of the house. It may be
right,
with the father, with the mother, and sometimes these girls are too shy to ask their parents also. So
right,
then we realize that we have to also, through the NGOs and through the actual, if I can say, getting deep into these slums, rural areas, societies, aspirational districts, like we're doing projects in Nandurbar. I mean, you can't even imagine where we have reached. And the whole idea is to work with three things: work directly with the girl child themselves. We have a program called the Adolescent Reproductive Sexual Health, which is the ARSH program. So, what we do under that program is that we reach these girls directly, plus through influencers, parents, teachers. So we have managed to reach, more than 1 lakh girls directly, managed to influence 2,500 of these influencers who will again reach out to more and more girls. And we have managed to also create 660 Kishori Manch. So Kishori Manch is a very excellent platform by which, a group of girls, actually it gives them a sphere to talk about taboo subjects, which otherwise they cannot talk about. So they will not even come and talk about it to you and me, but they can talk it about among themselves. So this is, has been a very, very rewarding journey. So I think that's a huge number that we have, traveled last year, and this will keep increasing because now those platforms are created and those communications are on, so it will only keep on increasing. In fact, through the digital, we have reached more than 2.5 lakh girls. But then, we focus more on the direct because we can study the impact and we know
right.
exactly how this girl has developed. So just a small example, like, one of the girls, she's a daughter of a commercial, sex health worker, commercial sex worker. And today, recently she has cleared the CA exam.
Yeah, that's very great to know. Yes. Right. So, as you're mentioning, so coming to digital, like in today's digital age, access to reliable information on sexual and reproductive health is crucial for adolescents. And many young girls feel uncomfortable discussing these topics openly due to cultural stigmas and personal shyness. And of course, technology has become an integral part of our lives. So, and as you like recently mentioned that Metropolis Foundation has launched the Too Shy to Ask app and website to enhance the digital outreach and provide vital information on sexual and reproductive health. So, is there anything you can shed more light on this? And also, I mean, what feedback have you received from the users around this?
Yeah, so actually it's very interesting, right? Because the digital space is completely insane and
Right,
you can reach any number of people, but at the same time, so I don't know whether you're aware, but there are all kind of websites and platforms which are there, the dark web or other
right.
things.
Hmm.
Students tend to go.
True.
I mean, they're just young, they don't
Mhm.
know, they search and they just land up into that space. And actually, they get non-expert advice and they get wrong advice. So the whole idea is to give, good advice. So we have these programs that we run with our NGO partners in which we have a toolkit and we actually give printed hard copies also, plus online also. So, and then our experts. So we have many experts. So Metropolis Foundation trustees are renowned names. We have Dr. Durusha, Dr. Safila Shroff, Dr. Prakash Gurnani, who each of them are experts in their own right. And along with that, many more experts are connected to us. So we are assuring all the people who are engaged with us that you're going to get the right information, which is scientifically correct, rather than any information. So that is one of our biggest achievements, I would say, that no wrong information is flowing. Information is prompt, it's structured, it's easy, it's in multiple languages. Because we feel, oh, English, Hindi is fine, but that's not true. So as you interact with more and more people downstream, you realize that they don't know anything apart from their local language, which is nothing wrong with it today. Even if you go to a Germany, nobody will know English, right?
Right.
So it's fine. So we have to be able to reach them in multiple languages. So I think that's been some of the success stories over there. Even in preventive healthcare, we've reached more than 4 lakh people actually. But again, you have to have a very strict monitoring and evaluation process. So wherever we feel that the end user is not getting benefited, or
Mhm.
where we are not being able to directly influence, there we should not spend our time, money, and resources. We should be very sure of what we are, really delving into and what is the impact.
Sure. I think there's a lot of positive uh, impact you have been creating in the society. When considering the sustainability and like the enduring impact of social endeavors, strategic planning, and collaborative partnership emerge as paramount. So, through years of experience, we have found that fostering community engagement, implementing scalable solutions, and prioritizing stakeholder involvement are key factors in ensuring the longevity of social projects. So, drawing from your expertise, what strategies have proven most successful in ensuring the longevity and lasting impact of social initiatives? And moreover, what guidance would you offer to organizations seeking to partner with foundations such as yours for collaborative efforts?
Yeah. I think, first of all, it's very important to be clear on your vision, your mission, your purpose, because if you don't spell it out properly, there will be chaos
Mhm.
because there's only this much money, there's only this much time, there is only these many human resources available. So you have to be very clear is what is the problem that you're looking out to solve? How are you going to solve it? By when are you going to solve it? And then how many other people are dealing with the same problem or working on the same problem? And then you have to have the collaborations. Without collaborations, it's not going to work. And the collaborations have to be with both public as well as the private sector, because you don't know where what is going on. So that has been our earnest attempt, and we have umpteen collaborations, without taking any names. We've done with you
Mhm.
all also. I think it's a wonderful collaboration, and that has really helped us. The another very important thing is that you have to be open to feedback. So when you are collaborating or when you're out in the field and you get feedback, you have to be adaptable. You have to be flexible. So for example, for MedEngage, we had a 1.0 version, and recently we upgraded to the 2.0 version. Now, what was so different in 2.0 version? We added an element of research, innovation, because we realized that, India is where the innovation can happen so much, but people don't have the money to do it. And we realized that these young medical doctors, when we give them the right amount of funds, we help them with their studies, they're able to do super specialization, they're able to go abroad if required, or they're able to develop. So if I look at all the MedEngage students, let's say 6,000 students we helped, out of that, I think about 80% of them have used it for skill development, for their own skill development or for their own, research innovation purpose. And that has helped them with either a good placement or a higher education, or, they've got funds for something else, which is again help back in their community or their hospital. So somewhere it has gone and added up. But that would have not happened if we wouldn't have heard the voice. They kept on saying
Mhm.
that we need research funds, and we realized, okay. Then we also realized that no, there are phases of medicine. So obviously, you have your MBBS, and you have your
Mhm.
internship, then you have your MD, and we realized the needs are different for every year. So we changed that also. Then you have to be very, if I can say, flexible and with current trends. So we used to have an essay writing, for example, 5 years back when we
Mhm.
started. But now with AI and ChatGPT, we
Mhm.
remove that because
Right.
now there's no point, because ChatGPT is going to throw out an essay in no time. So we realize, we have to change that model, because we have to keep finding the right talent to support. because the most talented person should get the support. So you'll be surprised to know that some of our students have even got through IAS. So there are some doctors, who have even now today, they have cleared the IAS, and they are going to, be a part of policy change. And that is, I think, the aspiration and dream of anybody who's trying to bring some change, that are you being able to change policies, advocacy? And that is, I think, where, we are coming. So Duru Madam has been able to do that along with the government, for various things in the past, and I'm sure she'll continue to do further also. She's the chairperson of Metropolis Foundation, and that is what Metropolis aims to bring about, policy change, advocacy change, because of our efforts, and statistics. Plain statistics should lead the way. Yeah.
True, and I think definitely they are already bearing fruits and will continue to do so in future. Coming to the next question, now CSR Box is preparing a compendium of aspirations envisioning India in its social development sector at its 100 year of independence. So my question to you is pertaining to the social development sector, what would India of 2047 look like according to your vision and aspirations?
Yeah, so that's a really special move, right? So when the Honorable Prime Minister announced this, that within 100 years of independence from 1947 to 2047, we should look, like a developed nation. We can no longer be a developing nation. So I think a developed country, I think India is making all the right moves to be a developed country. And, it's going to be a Team India approach. So, it's very interesting. Our CEO at Metropolis always talks about a Team Metropolis approach. So he always says it's the company first, function second, and self last. And I think if for Viksit Bharat, what you say, 2047 Viksit Bharat, if Indians also take a similar approach, so we think that, India first, then, company second, and self last.
Mhm.
I think we are in a good place, and we are going to not only impact ourselves, our children, our country, but we are going to spread this light across the universe, because as you can see, whether you pick up any country or you pick up any field, you will see an Indian in that. So not only will we spread the light in our country, but also be able to spread the light abroad, and that also again resonates with Metropolis thing. So as you know, Metropolis is a multinational chain of laboratories, and not only do we have chains of lab all across the country, about 6,000 centers, 125 labs, but we also have centers across the world. So now we are in collaboration with 19 countries. So we service 19 countries as we speak. And if through our initiatives we can reach all these countries, one of the countries that we service is Africa. And there are so much foundation works that goes on in Africa, So you have to find where the need is, where you have the expertise and the ability, and where you can put a clear path and collaborate with the concerned government, local authorities, NGOs, and be able to bring about a very defined, measurable change in a stipulated period of time. So one has to deal with it like a project, actually. And that is why, this corporate leadership or being a doctor comes into play. Because if you just do it like a social work, it's not going to happen. You have to do it like a social development, like an agenda, with a mission, with a strategy, with timelines. And I think that is where I've been able to work, with not only Metropolis Foundation Group, but also with the employees, improving employee engagement, volunteer engagement. So many people want to do good today, but are you able to let them know that here, hey, this is what you can do? And they feel good about it. And, that's how you can use more resources and then ultimately add up to what the country is progressing towards. So we don't want to. So if India is after Anemia Mukh Bharat, TB Mukh Bharat, we are involved because that's important. Cancer is a big burden. That's something, again, very close to my heart. But it's not in our current agenda. But when it will be, of course, it will be special because, again, there some help is required. But I would say that, we have to keep our eyes and ears open as to what others are doing. And we have to try and collaborate towards getting better statistics for the same purpose rather than spreading all over the place. And of course, as is a part of the Viksit Bharat thing, that, there has to be economic development, there has to be social development, there has to be good governance. All of these things are very important. You cannot have such a huge divide, between the have and the have-nots. So somewhere we have to reduce that gap, and that is what we are trying to do in all our endeavors, by One of the sessions that we had, the doctor who we had supported, and he became accomplished doctor, or the girl who I mentioned,
Yes.
sex workers family becoming a CA. These are now today, tomorrow, this will be a different family, right? So they
Right.
were first generation, they are first generation professionals of their families or of their communities. Nobody in that entire community has ever become a CA or a doctor or a whatever. And if we are able to move this one family, that's how you move towards a Viksit Bharat. Yeah.
Right. Very well said, ma'am. So coming to my final question for today, as a proactive leader in the healthcare sector, what guidance would you offer the younger generation on maintaining their health, preventing diseases, and leading a healthier lifestyle?
So I'll tell what
Mhm.
I tell my girls, right? I have 17 and 12-year-old daughters, and I tell them, be alert, be vigilant. What are you reading? What are you seeing? What are you watching? What are you spending your time on? Who are you engaging with? Who are you collaborating with? What are you studying? So I think being alert, being vigilant, leading a healthy mental and physical thing is balance is very important. We don't have to get obsessed, or go crazy about any
Mhm.
one thing. And I tell them you have to be adult, fine human beings, where you are able to cater to your own network, whether it's your friends, whether it's your colleagues, whether it's your society, whether it's your building, whether it's your organization, and also somewhere work with the larger have-nots. Like my own daughter, she goes to a orphanage on her birthday, and I think that's the best way to spend your birthday. So anything, any small change that they can bring. So the other day she's a footballer, and I told her, can you teach some young kids how to play football? Or can you teach some young kids who don't know how to speak English, teach spoken English? So I don't know. I think this community act of service, which has got introduced by all the institutions and colleges now, I think is an excellent gesture. And we have to teach our kids to, be aware of the society, to be aware of all the rungs of society, and not take anything for granted. Um, Study well, eat well, and sleep well. Yeah.
Sure, sure, Dr. Chair. Thank you so much for that expert advice. I must say your expertise and insights have truly enriched our discussions today. So as we near the end of the discussion, today's session, I would like to extend my heartfelt gratitude for your time and contributions to the society and sharing with us your inspiring journey. Thank you so very much.
Thank you.
Uh,
Pleasure
we
talking.
hope Same here. We hope all our viewers enjoyed this conversation and learning something new from Dr. Chadha. Please don't forget to join us again next week for the upcoming episode of Impact Talks, where we continue to share inspiring stories of individuals and organizations that are actively shaping the world for the better. Until then, this is Adesh, bidding you farewell, wishing you a fantastic day. Thank you. Thank you so much, Dr. Chadha.